Hello to all our wise and wonderful viewers. Today we're going to talk about something often considered taboo, but absolutely vital for living a full and joyful life at any age: sexual health after 70. Contrary to popular belief, sexuality doesn't vanish with age, it evolves, and research proves it. According to studies from the Mayo Clinic Foundation, seniors who remain sexually active experience lower rates of depression, better cognitive function, and even longer life expectancy. Still, many older adults slowly let this part of life fade away, not because the desire is gone, but because of discomfort, shame, or a simple lack of good information. Today, we'll share 6 science-backed secrets to help you maintain a healthy, fulfilling sex life after 70 tricky. This isn't about techniques or performance, it's about connection, health, and well-being. Let's begin. Secret 1. Redefine what intimacy means. The most important step is to expand your idea of what sex and intimacy truly are. Researchers from the University of Michigan found that couples over 70 who felt sexually fulfilled had one thing in common. They redefined intimacy. 85% expanded their definition beyond intercourse. Most reported greater satisfaction than when they were in their 40s or 50s. The focus shifted from performance to connection and shared joy. Here are a few ways to embrace this new approach. Explore non-genital touch and the pleasure of full-body sensation. Practice sexual mindfulness. Be present with every touch and emotion. Talk openly about what feels good now, not what used to. Enjoy simple moments: massage, shared baths, holding each other close. As Dr. Ruth Westheimer once said, after 70, the brain becomes the most important sexual organ. Secret 2. Adapt to physical changes gracefully. Aging brings hormonal and physical changes. That's normal. But with the right attitude and adjustments, they don't have to get in the way. For men, erections may take longer or feel less firm. Time between erections increases. Ejaculation may be weaker or absent. More direct stimulation is often needed. For women, natural lubrication decreases. Vaginal tissue becomes thinner and less elastic. Arousal takes longer. Sensitivity may shift. Helpful solutions. Use water or silicone-based lubricants. Avoid glycerin or parabens. Try vaginal moisturizers regularly, not just during intimacy. Choose moments when energy is highest. Use assistive tools like easy-to-use vibrators. Consider localized hormone therapy under doctor guidance. In fact, the North American Menopause Society reports that 72% of women who use vaginal moisturizers experience major improvements, even without hormones. Secret 3. Manage health conditions and medications. Chronic conditions like diabetes, hypertension, or arthritis, and the medications used to treat them can affect sexual function. But here's the key: these effects can be managed. Common meds that may affect sexual health: blood pressure drugs, antidepressants, bladder medications, cholesterol-lowering drugs, some prostate treatments. What you can do: never stop medications on your own. Talk to your doctor about any sexual side effects. Ask if your dose or prescription can be adjusted. Time your medication around moments of intimacy. Explore treatments specifically for sexual side effects. A major study from JAMA found that 42% of patients who discussed these issues with doctors were able to improve their sex lives without changing their overall treatment. Secret 4. Prioritize vascular and hormonal health. Sexual function depends on 2 things: good blood flow and balanced hormones. Support your vascular health by doing Kegel exercises. Yes, they work for men too. Getting 30 minutes of aerobic activity 5 days a week. Eating a Mediterranean diet rich in olive oil, fish, and veggies. Limiting alcohol to 1 drink a day. Quitting smoking. Support your hormonal health by taking vitamin D3. Getting enough zinc. Trying natural boosters like maca or ashwagandha. Discussing low-dose hormone therapy with your doctor. Maintaining a healthy weight. One study from the University of California found that older adults who followed a vascular health plan for 6 months saw a 57% increase in sexual satisfaction. For women, vaginal estrogen in creams or rings can restore comfort without the risks of full hormone therapy. Secret 5. Reignite emotional connection and novelty. After years together, couples can fall into routine and the spark fades. But neuroscience shows that novelty releases dopamine, the same chemical behind sexual desire. Here's how to bring that excitement back. Try the famous 36 questions for intimacy. Plan weekly dates with something new for both of you. Have 10 minutes of undistracted listening daily. Share your fantasies and desires. Make new physical rituals, a 6-second hug, holding hands, gentle cuddling. If you're single, join hobby or interest groups. Try dating apps for seniors. Take dance or fitness classes. Keep close friendships with emotional depth. Studies show that couples over 70 who try new activities together report levels of desire similar to younger adults. Secret 6. Embrace self-care and a positive body image. Body image often becomes a hidden obstacle to intimacy after 70. But confidence is ageless, and it's built from the inside out. Here's how to feel good in your body. Use positive affirmations. Talk kindly to yourself. Focus on what your body can feel, not how it looks. Wear clothing that makes you feel attractive and confident. Use soft lighting during intimacy. Try mirror bathing. Look at your body with compassion, not criticism. Support your sexual wellness with good self-care. Stay hydrated. Get restful sleep. Manage stress. High cortisol levels lower sex hormones. Keep hygiene gentle. Avoid harsh soaps. Stretch daily for comfort and flexibility. The University of Sydney found that seniors who accepted their bodies were 3.4 times more likely to enjoy a satisfying sex life, no matter their health or appearance. Final thoughts. These 6 secrets, redefining intimacy, adapting to change, managing health, staying physically and hormonally strong, reconnecting emotionally, and loving your body, create the foundation for a vibrant, joyful sex life after 70. Remember, your sexuality is not behind you, it evolves with you. As Dr. David Schnarch once said, the best sex of your life doesn't have to be in the past. It can be in the moments where you choose emotional growth and deeper connection. Coming up next week, the 5 essential nutrients your brain needs after 75 to stay sharp and fight cognitive decline. If you found this video helpful, give it a thumbs up and share it with someone who needs to hear this. Until next time, stay wise and stay connected.